Hello, and welcome to our interactive overview. This program will review basic information about root canal treatment, also known as endodontic treatment. An endodontist is a dental specialist trained to evaluate and treat pain associated with your teeth. Since it is important that you are evaluated on an individual basis, we will only address general information about root canal treatment. Your endodontist will explain your individual treatment needs. This interactive program will run automatically, or you can use your mouse to select the answers to specific questions. Please review all of the information before your consultation. Your tooth consists of two main parts, the crown and the root. The crown is what you see when you look in your mouth, and the root is the part of your tooth that is below the gum line. The crown consists of dentin, covered by a layer of white enamel. The root canal is a tiny channel inside your tooth containing the pulp, called the nerve. The pulp consists of blood vessels, a system of nerves, and connective tissue, which produces the hard interior, called the dentin, of your tooth during development. Once the tooth has developed, the pulp can be removed if it becomes damaged, and your tooth can usually be restored to a healthy condition. Generally speaking, as far as function and comfort, there is no difference between a tooth that is endodontically treated and a tooth without root canal treatment. During root canal treatment, a small opening is made in the crown part of your tooth. The pulp is removed and a root canal filling placed. Most root canal procedures are non-surgical in nature. After treatment, care must be taken to protect your tooth by having a permanent restoration placed by your restorative dentist to prevent further complications. In most cases, the restoration is either a permanent filling or a crown. If you choose to save your tooth with endodontic therapy, your treated tooth will function just like any other tooth. It will continue to maintain the spacing of your other teeth, allow you to chew foods, and it will look the same or better than before. While endodontic treatment is usually preferred to extraction, you can elect to extract a tooth that needs endodontic treatment. If your tooth is extracted, you will need an implant or bridge to replace the extracted tooth and maintain the proper positions of your other teeth. In addition, you can choose no treatment at all, but you may experience severe pain and swelling in the future, which can impact your overall health. All patients can benefit from root canal treatment if indicated. This is especially helpful for elderly and medically compromised patients. That's because endodontic treatment is less traumatic than an extraction and maintains the natural function and aesthetics of your mouth. In general, root canal treatment is much less expensive and time-consuming than extraction and replacement with an artificial tooth. The fees associated with endodontic treatment are based on the difficulty of the tooth. Typically, molars are the most difficult type of tooth and usually cost more. Teeth with calcified or narrow canals, very curved canals, retreatments, and surgical procedures require more sophisticated treatment and are therefore often more expensive. Most dental insurance policies cover root canal treatment and follow-up care to some extent. You should eat a full breakfast or lunch as appropriate before your visit. In addition, make sure to take your routine medications unless you have been advised otherwise by our office. During your consultation, please tell your doctor about your current medications, including over-the-counter and herbal medicines. Be sure to mention any changes in your medical status since your last visit if you have previously been in our office. Also, feel free to discuss any concerns you may have about root canal therapy versus possible alternatives. And lastly, relax. Modern root canal treatment is usually painless. After treatment, any discomfort can usually be managed with over-the-counter pain medications such as acetaminophen, Tylenol, ibuprofen, Advil, Motrin, or aspirin, Bayer. Your tooth will normally be sensitive to touch and chewing for a few days after treatment. This is because pre-treatment and post-treatment irritation causes the membrane surrounding the tooth to be inflamed. Patients normally are able to return to work immediately after root canal treatment. Complications are rare, but swelling and discomfort can occur. These problems should be reported to your endodontist promptly. An endodontist is available on a 24-hour basis should a problem arise. A written report of your treatment, including a final x-ray, will be sent to your restorative dentist. You should contact your restorative dentist's office for a permanent restoration within a few weeks of treatment. Your tooth is more prone to fracture immediately after endodontic treatment. You should chew on the other side until your restorative dentist has placed a core buildup and a protective restoration, usually a crown. If your tooth strength is seriously compromised, your endodontist or restorative dentist may place a post and core buildup inside the tooth. Your restorative dentist and endodontist will determine the appropriate restoration to best protect your tooth. There are several options available to patients who have problems with teeth after routine endodontic treatment. One is to redo the original root canal treatment, called retreatment, and another is to perform surgery to fix the problem. Sometimes retreatment along with endodontic surgery may be recommended. If the tooth has a significant fracture, either retreatment or surgery may not be able to repair the problem. Your endodontist will explain your options and make recommendations. Occasionally, teeth that have previously had root canal treatment may require additional treatment because of continued infection, which may involve taking out the root canal filling and further cleaning and disinfecting of the root canal system. After refilling the root canal system, further observation is required to ensure healing. This procedure can save a tooth which would otherwise be lost. However, if the tooth has a fracture in the crown that extends into the root structure of the tooth, the chance of success may be diminished. Sometimes retreatment is not possible because of other reasons, such as unusual anatomy or a narrow or blocked canal. Your endodontist will assess your individual situation and will inform you of the chances of success of retreatment and if surgery is an option before proceeding with treatment. Sometimes routine endodontic therapy cannot effectively treat your root canal problem. If this is the case, you will be informed either before treatment or after a complication becomes evident during or after routine endodontic treatment. Before surgery, your endodontist will administer local anesthesia as with a normal filling. Make a small incision in your gum and clean around the tip of the root. Often, an additional filling will be placed at the end of your root to further seal the apex or tip of the root. This procedure will remove the infected tissue and help restore the tooth to health. A sample of the infected tissue may be sent to a pathologist for examination. Follow-up examinations will be scheduled to observe healing. There is a slight possibility that nerve injury can occur during root canal surgery to the lower posterior teeth. Your endodontist is trained to assess this possibility prior to treatment and will advise you accordingly. For lower posterior teeth, the root tips may be near a nerve that supplies feeling to the lip, chin, and gums. Your endodontist is trained to design your surgery to minimize the chances of damaging this nerve. Rarely, this nerve can become irritated during the process of surgery. In these cases, when the local anesthesia wears off, you may experience tingling, altered sensation, or, in rare cases, a complete lack of feeling in the affected tissues. Should this occur, it is usually temporary and will resolve over a period of days, weeks, or months. In rare cases, these changes can be permanent and/or painful. The upper teeth are situated near your sinuses, and root canal surgery can result in a communication between your mouth and the adjacent sinus. Should this complication occur, it will usually heal spontaneously. We will give you special instructions if this is apparent at the time of surgery. We prefer that you don't blow your nose for 2 or 3 days after surgery. If you have to sneeze, you should sneeze with an open mouth into a tissue. You should not create any pressure in the sinus area. If you sense a complication after surgery, please contact us. Post-operative infections occasionally occur. This usually requires just an office visit and examination. Many times placing you on an antibiotic for 1 week will take care of the infection. Occasionally, other follow-up procedures will be needed. If you still have questions or concerns after reviewing this presentation, please call our office and speak to one of our patient coordinators. They're trained to answer your concerns. Thank you for listening to our presentation.